Familiar with, but maybe don't talk about when it comes to the health side of things. We're going to get real and talk facts about the risks tied to oral sex, and more importantly, how you can navigate them. Okay, let's get right into it.
So here's the big question, right? Is it completely safe? There's this common idea that it's the safer option compared to other kinds of sex. But here's what we need to ask ourselves. Does safer actually mean 100% safe? Let's unpack what the science really says.
Look, there's no doubt this is an incredibly common and normal part of many people's sex lives. But the key thing to wrap our heads around, and this is really the core of our whole discussion, is that safer does not mean zero risk. It just means the risk profile is different. And in some cases, it includes risks that, honestly, just don't get talked about enough.
All right, so to make sure we're all starting from the same place, let's just weigh out the clinical definition. We're talking about direct contact between the mouth and the genitals, and that means there's an exchange of fluids like saliva and vaginal secretions. It's that exchange, that direct contact, where the possibility of transmission really begins.
Now, this is a really crucial point. The risk here is bidirectional. It goes both ways. A lot of the time, the conversation focuses on what the person performing oral sex might get, like a throat infection. But the reality is risks exist for both partners. It's a two-way street, and that's something we're gonna keep coming back to.
Okay, so let's start with the first big category of risk, STIs. A lot of the sexually transmitted infections you've already heard of can absolutely be passed through oral vaginal contact, and sometimes in ways that might actually surprise you.
And wow, this list really shows you the scope of what we're dealing with. You've got everything from HPV and herpes to bacterial stuff like gonorrhea and chlamydia. Now, you'll see HIV on there as low risk, and it is, but low doesn't mean no risk, especially if there are any cuts or sores for the virus to get into. The main takeaway here is that the potential for transmission is way broader than a lot of people think. So out of all those STIs we just saw, health experts really point to one as the biggest long-term worry, and that's HPV. Why? Because certain high-risk strains, when they're transmitted orally, can lead to oropharyngeal cancer, which is just a technical term for throat cancer. And that is, without a doubt, the most serious risk we're talking about today. So for summarizing the major players, you've got HPV, and it's linked to throat cancer. You've got herpes, which can cause sores on either the mouth or the genitals. And then you have gonorrhea and chlamydia. And here's the really tricky part with those two. When you get them in your throat, they are often completely asymptomatic. You could have an infection, have no clue, and be passing it on. But hold on, the risks don't just stop with STIs. This simple act of moving bacteria and fungi between two totally different environments in the body, the mouth and the vagina, can create its own set of problems. And this is another perfect example of that two-way street we talked about. Think about it. The bacteria from someone's mouth can get into the vagina and throw off that delicate ecosystem down there, which can sometimes lead to things like bacterial vaginosis, or BV, and yeast infections. And while it's less common, it can happen the other way around too. So if risk isn't just a simple yes or no thing, what are the factors that can actually crank up that risk level? Because not every situation is the same, and knowing this stuff is what helps you make smarter choices. This chart lays it out so clearly. On the one hand, things like poor oral hygiene, we're talking bleeding gums or canker sores, literally create open doors for germs to get into the bloodstream. Having multiple partners you haven't tested with or the presence of menstrual blood also ups the risk. But on the flip side, being in a monogamous relationship where you're both tested and using barriers like dental dams, that brings the risk way, way down. Okay, so we've spent a lot of time on the risks. Now let's switch gears. Let's talk about what you can actually do about it. This is all about empowerment, not fear. This is your practical guide to staying safer. It really boils down to 4 key things. Number 1, use a barrier. Dental dams are designed for this. Number 2, get vaccinated. Seriously, the HPV vaccine is a total game changer for preventing those cancer-causing strains. 3, get tested on a regular basis. And 4, a really simple one. Just take care of your oral health. If you have a cut or a sore in your mouth, maybe skip it for a few days. And this table just drives it all home. Each method is like a different layer of armor. Barriers block direct contact. Vaccines stop specific, serious infections before they even have a chance. Testing gives you and your partner critical information. Knowledge is power, right? And good hygiene just closes off those easy entry points for germs. When you use them together, you're building some really powerful protection.
If you're going to remember one sentence from this entire explainer, make it this one. It sums up what major health organizations like the CDC and the NIH have found. And that nuance is so important. Lower risk for some things, yes, but absolutely definitely not risk-free.
And that's really the whole point, isn't it? This isn't about scaring anyone, it's about giving you the knowledge you need. When you understand the full picture, both the risks and the ways to prevent them, it stops being a gamble and starts being an informed, conscious choice that you and your partner can make together. So, we're going to leave you with this final thought. Your health is a team effort, and that means communication is everything. Having this information is the first step. The next, and honestly, the most important step, is turning that knowledge into a conversation.